What is randomization and why will it determine my treatment?
So that's a very important question. In this case, the patients that are being entered in this study, such as yourself, are either women, Black, or Hispanic patients who have extensive blockages in the arteries of their heart. They have either a blockage in the left main coronary artery, which is the probably arguably the most important little blood vessel in the entire body because it covers a lot of the heart muscle, or they have blockages in many of the different vessels in the heart, what we call multivessel disease. And the two ways to treat that are with stents or with surgery. Traditionally, surgery has been the standard way that we would treat extensive coronary artery disease, but stents have gotten better and better. And at least we know in white men that there are, from many, many trials and more than 20,000 patients, that there are many different types of blockages in left main and multivessel disease that can be effectively treated with stents. But we don't have that knowledge in women, in Black or Hispanic patients. So we have to do these types of studies, which are called randomized trials. And randomized trials mean that half the patients will get a stent procedure first. The other procedure, surgery, will always be available if they ever need it, but at least first they get started with a stent procedure. The other half of the patients first will get started with the standard bypass surgery procedure. And of course, stents will always be available for that patient if they ever need it. In fact, your care is always going to be according to best medical practices because both stents and bypass surgery are standard medical procedures. They're not investigational. They're FDA approved. They're done hundreds of thousands of times every year in the United States. So all we're trying to do is, in Recharge, is figure out by randomizing you, that is deciding by chance, 50% of the patients get stents first, 50% of the patients get bypass surgery first. Now, if you do join the trial, you don't get to choose, okay? The trial will choose randomly for you. However, as I mentioned, both procedures are ultimately available for you, as well as the full range of other medical therapies as you need it.
And let me just add to that if your physician approach you for participation in this study, it means that based on everything we know, we have no reason to believe that one or the other intervention will work better for you. So there is what we define equipoise. So we really don't know which treatment is better, and or probably better said, both treatment can work effectively in a patient like you. And the randomization is only about which treatment are we going to start with, because over the course of a long period of time, 10 years like this study, it's very likely, the majority of the patient will receive both intervention, and the other intervention will always be available for you if needed. So even though this idea of randomization may be a little bit scary and uncomfortable at the beginning, I don't think that you should be focusing on the randomization part too much. I think signing up for this study means that you will be working for 10 years with a group of investigators and physicians who are really motivated in improving the outcome of patients like yourself, who will be working with you, will be calling you very often, will be checking on you. And this is all done to improve your own outcome by this very close follow-up, but also the outcome of a patient like yourself who will need coronary revascularization in the future.